that you can infect and whose lives will then be put at risk. And I say this now on Sunday afternoon, Sunday evening. Take this advice seriously. Follow it, because it's absolutely crucial. And as I've said throughout this process, we will keep the implementation of these measures under constant review. And yes, of course, we will bring forward further measures if we think that is necessary. So always remember, in following this advice, and I know how difficult it is, but always remember that each and every one of us, you are doing your bit in following this advice. You're doing your bit to slow the spread of the disease, and the more we collectively slow the spread, the more time we give the NHS to prepare, the more lives we will save, the faster we will get through this. And always remember, we will get through this, and we will beat it, and we will beat it together. So next, Robert Jerry, to outline the shielding measures that we're going to be bringing forward in the next few days. Robert.
Well, thank you, Prime Minister, and good afternoon. As a nation, we're confronted with the need to make big changes and enormous sacrifices to our daily lives. And this is especially true today on Mother's Day, when many of us would want nothing more than to be at home with our loved ones in person. But in recent weeks, heroic workers in the NHS, in social care, our public services, in local government, and many others have been shouldering the country's burden. And I think we owe it to them and to the most vulnerable in society to stay at home, to protect the NHS, and by doing this, to save lives. And as the Prime Minister said, our response from the outset to the virus has been guided by scientific evidence, and our action plan set out the interventions that would be required to be deployed at the right time. And so today we have to go further and shield the most clinically vulnerable people to help save their lives. Following the Chief Medical Officer's guidance, the NHS has identified up to 1.5 million people in England who face the highest risk of being hospitalised by the virus. The NHS will be contacting these people in the coming days, urging them to stay at home for a period of at least 12 weeks. I know that many people will want to know whether this applies to them. This will include people who are living with severe respiratory conditions, specific cancers, such as of the blood or bone marrow, those who've received organ transplants, and some, though not all, of those receiving certain types of immunosuppressant drug treatments. The full list of conditions is now online at gov.uk/coronavirus. Now, I don't underestimate what we're asking of people. It will be tough. But if you are one of these people, I want to reassure you on behalf of the government that you're not alone. We will be with you throughout to support you. And let me set out what we're doing and how it's going to work. This week, the NHS will contact people by letter identified as being of higher risk of severe illness from coronavirus. This will also be followed up where possible by text and by phone call. We'll be asking these people not to leave home at all, to avoid face-to-face contact for 12 weeks, all to protect themselves. I know people will worry about what this means for family members and for carers, for those without family and friends and neighbours close by. They'll worry about how they'll be able to receive medicines and essential supplies. And I know people will feel anxious about supporting their mental health as well as their physical health. So let me address those concerns. Others in the household will not be required to adopt these protective, shielding measures for themselves. However, they must follow the Public Health England guidance on social distancing. Carers both formal and informal, can continue to visit, but again they must follow the additional measures set out by Public Health England. For people who do not have support in place around them, who don't have a network of family and friends close by, we will be creating a network of local hubs covering the whole country. This will require a major national effort.